Hello, my name is Dr. Ruben Rafaelov, certified NAET practitioner and instructor. And joining me is Jennifer Hande, registered nurse and also a practitioner of NAET. We're coming to you live from the NAET.com studio, where we'll be discussing today emotion treatments, things that you can do at home or wherever you are, where you're feeling not so well and you want to feel better. What do you do? What can you do? We're going to be going over that today.
Yes, this is super exciting. Our goal is to empower you that in the moment of an emotional crisis where you just are not feeling your best, you can find a quiet spot to do this treatment that we're going to show you and get yourself rebalanced in the moment. So this is an acute protocol that we're going to show you today.
And it's very effective, and you don't need anything except your two hands.
Yeah, it's really perfect. So let's just talk emotions.
Yeah.
You know?
Most of the time in our society, either emotions are downplayed or it's frowned upon to be experiencing negative emotion, or we just never taught how to handle negative experiences. Do you want to add anything?
Yeah. Jennifer? I find that just in our Western society, emotions are kind of viewed as negative, especially negative emotions. Even positive emotions, sometimes if someone's too excited or overwhelmed in some way, a lot of emotions aren't given the proper respect. And so sometimes people don't want to feel negative emotions, so they'll go into an avoidance situation. They only want to feel positive things. So this is going to be a treatment to kind of allow you to kind of deal with those emotions.
Most importantly, I feel like maybe a lot of times people may put off as a smiling face, but inside they're really hurting. So this is not just so that way you can say rah, rah, and get motivated and feeling good, right, on the external, but more about how do you feel good inside. And that's exactly what we're going to be focusing on.
So, it's pretty amazing. The way we view allergies, most people probably wouldn't think that you could actually be allergic to an emotion.
To an emotional experience. And very differently than how we view an allergy in Western medicine. In Western medicine, we view an allergy as an immune reaction, immune response. And normally we would see that in either tightness in the chest or trouble breathing or a rash or hives or things like that. An allergy in a Western medicine approach is viewed as an immune reaction from an allergen, whether it be something in the environment or something in the side of the body, like in an autoimmune reaction.
Right.
Whereas in an energetic medicine, holistic medicine view of an allergy is more broad in that it's an undesirable and inappropriate response. And that can mean by all different types of mechanisms, including emotional responses.
Right. And it's so interesting because when we think about it, if we have a negative emotion that we're feeling, we do feel the sense of like our system, our energy just shutting down. And it's kind of similar to having an allergy to something. Let's say we ate something and it just doesn't sit well with us. Where it stems from is from an energetic component, where our body is just inappropriately reacting, and we can teach you how to clear that so that your body becomes balanced again.
I know everyone's excited to get to the technique, so we'll spare the scientific jargon and we'll go right into it now.
Okay, so there's 2 points that I'm going to show you first. So you're going to take your right hand with 3 fingers and you're going to put it on your sternum. Okay? Your left 3 fingers are going to go on your chest, right here. Now, while maintaining contact, you're going to start tapping your right fingers right over the sternum. This is called CV13, that's the point. And for 1 minute, you're going to tap. Now, while you're tapping, you want to relive the incident or the trauma that you just experienced. I do want to point out this is something good to do, either sitting or lying down. You don't want to do this standing, and you want to find a quiet place where you can concentrate on your thoughts, close your eyes, and like I said, for 1 minute, you're going to hold on to this point. You're going to tap for 1 minute on the CV13 point. When that minute is over, you're going to tap on stomach 16 right over here while maintaining contact on the sternum for 1 minute and reliving that incident, the negative emotions that you felt, the trauma that you felt, and in your mind just keep replaying what happened.
And what Jennifer is referencing are these acupuncture points or acupressure points. So if you're not familiar with those terminologies, just look at where my fingers are. Again, my left hand is right over my chest, left side of the chest, and my right 3 fingers are right where the sternum is,
Yes.
and then the sternum. And the idea is, again, to reiterate, we're doing 60 seconds here reliving the experience in our mind, 60 seconds here reliving the experience in our mind, and then what's next, Jennifer?
Then we are going to go to the wrists. So you're going to start with the right wrist, and you're going to tap for 1 minute.
No, we're going to do clockwise.
Oh, sorry. Massage clockwise. So starting again, the next thing we're going to do is on the wrists. You're going to massage for 1 minute clockwise, thinking positive thoughts about the incident. And you're going to do the same thing on the left side, the edge of the wrist. This is heart 7, the acupressure point. 1 minute clockwise, thinking and reliving the experience from a positive perspective.
What would be the new perspective or a different perspective that you can view the situation from, as what a lesson you can learn from the experience, how grateful you are that you came out of the experience. And a lot of times, in traumatic times, it actually brings people closer together. So the relationships that you're now, these new bonds that you're creating with the people around you, can be strengthened in negative experience. So again, there's always something positive to get from something negative or something uncomfortable. This is about how do we help you not avoid situations, but overcome them and work through them and be better now that you've had that great that experience.
It is important to note that this treatment that we're showing you is for acute situations. So if something just happened, you're stepping out of the room, you're taking your time, and you're rebalancing yourself. This is not for chronic things. So a practitioner is really a good resource when you want to get long-term relief. So this is a wonderful technique that you could utilize wherever you are, and hopefully we should have very healthy, happy times together.
Jennifer, thank you so much. What I wanted just to clarify is, what are some of the traumatic or negative experience or uncomfortable experiences that this approach would be valid or appropriate for? So again, we're going through some challenging times right now. So if you are really uncomfortable with the current situation of being stuck somewhere, or not being able to go somewhere, or being separated from certain family members or friends, or from your work, or from traveling.
Yeah, so it sounds like financial stressors, emotional stressors with relationships. Definitely isolation, health. A lot of people are afraid of getting unhealthy, or they're afraid of themselves or family members. So there's so many opportunities right now to really get treatments for that. Yeah,
again, for you to treat yourself. And in the beginning, in the first few days and weeks that you're doing this for yourself, you're going to notice you're doing it very often, which is totally fine. But most importantly is you're going to feel amazing afterwards. And after a certain time, you're going to notice you're going to need less and less of these self-treatments, because you'll be able to get through them with ease naturally. And that's the idea. How do we go through traumatic experiences with ease? And that's what this technique is for. And when you're needing more chronic or long-term relief from a particular situation or an imbalance, we definitely recommend you reach out to an NAET practitioner or seek out the assistance of another qualified practitioner to help you along your health journey. This is Dr. Ruben.
And Jennifer.
Thank you so much for watching. And please, if you'd like to learn more, go to naet.com.